This is a democratic network. You just come around us here. Let's make this a togetherness thing.
I like that idea.
Thank you and good morning. I'm Congresswoman Grace Napolitano from California, and we're here. Of course, I want to thank all the folks that are here from the mental health community and supporters and advocates. We're here to spread the word and to be sure that everybody understands that May is Mental Health Month, and mental health awareness is what we're trying to promote. We want to recognize it. We're expecting the White House to send a proclamation, and that should be forthcoming because we've had it in the last couple of years. We're pleased to join our advocates, to have them join us and to be able to be with us today to destigmatize the issue. Of course, as you know, it affects millions of Americans. It is the invisible illness. It ranges from depression, to anxiety, to bipolar, to schizophrenia. Excuse me. I get excited. The month of May draws attention to us wearing lime green. Lime green is to promote mental health. Please do not be afraid to speak up, to be able to ask for help, to be able to understand that this is something that you could get some assistance in being able to address. It is all right to ask for help. We started a program back in 2001 as a pilot program on placing clinicians in schools, so it's now in 26 schools. We have a bill, HR 1211. It is a bipartisan bill that provides on-site mental health clinicians in schools. We must start addressing mental health issues at an early age because that's our future. I'm sorry. I'm sorry. I've got a sore throat. Jill, come on. I'm going to start. Sorry about that.
Do you want me to read this or just go?
We must educate parents, administrators, families, and communities. We must learn the warning signs, extreme change in behavior, and verbal cues. Society must work together to eliminate the stigma, including the media. We have to share mental health resources and use the National Crisis Hotline, 1-800-273-TALK. 24-hour confidential hotline, and it could also assist veterans.
Thank you so much. I'm sorry. It's just I have a sore
pleasure.
throat. Thank you, my dear. Thank you. Now it is a pleasure to introduce some of the Mental Health Task Force, the members who share the message of hope. We want to reach a larger audience, and including especially our youth. But we have collaborated with mental health advocates through the years to bring more attention and to destigmatize the issue. First, I'd like to introduce, you just saw her move up and fill in for me, Jill Diamond, multiple Emmy winner, chair of World Boxing Council CARES, World Boxing Council Championship Committee, the NAFBF Female Championship Committee, who has helped us tremendously in the last few years, helped secure promotion in mental health and WBC matches, including Mayweather-Pacquiao. And if you'll notice during those fights, they're wearing the green ribbon because of the work she's been doing to help us out. So Jill, thank you so much, and thank you for being here. Jill?
It's a privilege for the World Boxing Council to be a part of this. Many of our boxers come from disadvantaged backgrounds, and we are so appreciative of the work that Grace and the people behind me do. I don't think any of us have not witnessed friends and loved ones whose the quality of life has deteriorated. They've lost their lives themselves because they were ashamed or afraid to come forward. We have to stop the stigma. Mental illness is a brain disorder, just like diabetes or anything else that needs treatment. Our children, they kill themselves, they kill each other because they're afraid of the rejection and the shame, coming forward and saying that they don't fit in or they don't feel normal. I personally think we need to redefine the word normal. I don't know what that means anymore. But what we can do is try and break the stigma, because we can't cure everyone, but we can change our perception of mental illness so that people are not silenced. In gratitude, the World Boxing Council would like to thank Grace and present her with this plaque to show our appreciation.
wondering what you were up to. Thank you, my friend. Thank you to Jill. She's been excellent in helping us promote more mental health awareness and destigmatization. So Linda Gargan, Executive Director of the National Federation for Families for Children, Mental Health. She provided all our green ribbons today and will provide a reminder for a group photo. We'll be having a group photo following this conference. So Linda, please.
Thank you, Congresswoman. Thank you. On behalf of the National Federation, I would like to thank each of you for helping us to raise awareness about this very important issue of children's mental health. For 25 years, the mission of the Federation has been to advocate for services and supports for children with behavioral health challenges and their families. We believe that every child deserves the right to reach their maximum potential and to mature into fully productive citizens in their communities. Through the creation of evidence-based practices that are accessible to all children and the elimination of the stigma that is often associated with behavioral health challenges, we believe that we can unleash the potential of these children and their families. We simply cannot allow the correctional system to continue to be our largest mental health provider in this country. I would like to publicly thank Congresswoman Grace Napolitano, who continues to be a tireless champion of children with behavioral mental health problems and their families. She serves as a true inspiration. Her leadership helps us to highlight the message that there is no health without mental health. And now I will introduce to you Debbie Plotnick, who is the Vice President for Mental Health and Systems Advocacy for Mental Health America.
Thank you, Linda. Good morning, everybody, and great thanks to Congresswoman Napolitano. It's my pleasure to be here today representing Mental Health America. Mental Health America is the nation's oldest advocacy organization. We're celebrating our 106th birthday this year, and we come from the voice of lived experience, meaning people with mental health conditions speaking out about recovery. And Mental Health America stands for some very simple things. We stand for prevention from mental health conditions for all people. We stand for early intervention at the earliest signs because we know that mental health conditions are conditions of childhood. All major mental health conditions start having symptoms in childhood, at the latest by adolescence or very early adulthood, which is why we're so grateful for the Congresswoman for the Mental Health in Schools Act. Mental Health America also stands for treatment for all people who need it, a continuum of care in the community. And we know that recovery can be a goal for everyone. So it's my privilege and pleasure today to work with all of the wonderful people standing behind me, the mental health advocates. Our community is united, and we invite all of you to join with us in support of getting the word out about helping people to identify early, to come forward, and to we urge the members of Congress to support the passage of the Mental Health in Schools Act. It's where the kids are, and that's how we get to them. So again, thank you, Congresswoman. Oh, excuse me, and it's my privilege. I've got to introduce Darcy. Darcy Gutierrez is the director of NAMI's Child and Adolescent Health Center. Darcy?
Thank you. Thank you very much. And I am with NAMI, the National Alliance on Mental Illness. And we would like to thank Congresswoman Napolitano, as my colleagues have, for her leadership and her continued support of children and adolescents with mental health conditions. We know that 1 in 5 children and youth are impacted by a mental health condition. We know these conditions start early. We know research shows us, research supported by NIMH shows us that 50% of lifetime cases of mental health conditions start by age 14. So to not recognize in a supportive way the critical role that schools play is extremely, extremely important and an overlooked opportunity. We know that less than half of children and youth that live with mental health conditions are identified, and schools can play a critical role in that early identification and early intervention. So we need to support schools. As all of you know, schools have a tremendous amount on their plates. They have a tremendous amount of activity that they're required to address, but we can create partnerships between schools and community mental health providers to really make a difference so that children are identified, so that we don't see them end up dropping out and failing in school and becoming entangled with law enforcement and unfortunately having contact with the juvenile justice system. So NAMI stands firmly behind the Mental Health in Schools Act. We learned a lot after the tragedy in Newtown about the important role that schools play. Now we need some serious action to really support schools so they can play a bigger role. So thank you, Congresswoman Napolitano, for introducing the Mental Health in Schools Act, and NAMI will work with these colleague organizations to see that legislation passed. I stand here now and introduce my colleague who's also been a tremendous champion for children's mental health, Bethany Lilly with the Bazelon Center for Mental Health Law.
Thank you, Darcy. I really appreciate it. And as Darcy said, my name is Bethany Lilly and I'm with the Bazelon Center for Mental Health Law. Darcy really kind of highlighted how important identification is, but just to follow on and why we support the Mental Health in Schools Act is that services are such a fundamental part of this. I mean, once we've identified children, they need accesses to the right kind of evidence-based practices that we discuss in the bill. And we just want to extend our greatest thanks to Representative Napolitano and all of the advocates behind us. This is one of those issues that everyone should be behind. Thanks so much. I'll now be introducing Trevor Summerfield. Trevor?
Thank you. Well, good morning, everybody. It's a pleasure to be here today, and thank you so much, Congresswoman Grace Napolitano. You've proven today that you speak so much about mental health that sometimes you can lose your voice because we have a lot to talk about. I'm here representing the American Foundation for Suicide Prevention, the nation's leading nonprofit dedicated to preventing suicide through education, research, and advocacy. As I'm reminded today with all of the school children walking around how important it is to raise awareness about mental illness as quickly as we can, especially as people continue to grow. I was thinking about this morning, and the NFL, I think, has really done a great thing with educating youth about mental illness and concussions. And I think as we continue to educate more and more youth and they grow up, they're really going to be the next generation of people who can identify early and prevent mental illness, which ultimately leads to suicide. Unfortunately, our organization represents one of the worst case outcomes when it comes to untreated mental illness. But when we look at suicide, 90% of those that are completed take place with people that have a treatable, diagnosable mental illness. And it's events like this that we're having today and also through the month of May. And again, thank you so much to Congresswoman Grace Napolitano for highlighting the importance of mental health awareness.
Thank you so very much. And as you can see, we have some heavy-duty advocates, but I can't tell you that this is not an easy task because it is something that people don't want to talk about. They don't want to recognize it because of the stigma. But my hat's off to the World Boxing Council, to all of the organizations. And if you see the green ribbon on the fighters, you know that they are with us. World Boxing Council cares. It is a tremendous assistance to all of us. Unfortunately, it is not something that is quite popular here in Washington to be able to fund it, to be able to recognize it, and I think we need to continue working. This is just the beginning. We've been doing this for at least a decade, which maybe if it takes another decade, but we're going to be successful in making sure that our children and our adults have the proper assistance when they need it, where they need it, in the appropriate language. Unfortunately, it's not something that is easy to do. Budget requirements are always in the way, but we would want to thank all our advocates, those that are here, those that are not here, to continue working with us to try to destigmatize and try to provide more funding for provision of those services that our children and our veterans, especially our veterans, because we still have been told it is still 22 suicides a day. And that's unfathomable. It's intolerable. Our children are important to us. They're our future, and they're our future leaders. And somehow we must continue to fight on for them and for our future. So with that, I thank you so very much. If there's anybody that has any questions of our group here, they're more than welcome to ask if anybody has any comment, any question. Well, thank you so very much. There will be a picture of our advocates and some folks on the steps. If you want to join us, you're more than welcome. So I thank you all. Thank you to my friends, and we keep the fight going. Thank you so very much.